changed as dentistry. And this is really, really important to understand, because when you start doing dentistry, when you start talking about your treatment plan, it's important to you, what is the biology behind your thinking? What is the rationale behind your thinking? Because when you start writing letters to patients on their treatment plans, you can understand, it's not like whenever the implant consent letter you get a signed ICOI or this consent letter you sign, it means nothing on the court of law. What really is important is, what is your rationale to that patient for that treatment at this point in time? That's what you're going to think about. So let's move on. One of the important things I like to talk about is that what we know really stops us from learning. And it's so important that Einstein put it early on. I really think this concept. So when I started exploring this avenue, I got first introduced to piezosurgery back in 2004 when Mark Schlick from Germany came here and got the instrument training. So I have a lot of experience in piezosurgery. It's daily used in my practice. I'm also a prostate and implant surgeon. There are a lot of cases, I've seen a lot of patients who had a lot of failures. You learn from your failures. You actually learn from your cases, not from the other people's cases. But Derek asked me, this is going to be a lot of my lectures on theory, there's a lot of cases afterwards. Derek said, well, why don't you just put this case up, beginning, just to get a sweetener, is that right? Sweetener, just to get people thinking. Here's a patient at the age of 60, I'll have a video soon. I won't put this on Facebook, it went viral, I think, get a lot of views. And that's within 6 weeks of treatment. Now, if a lot of you look at this patient, you probably think, well, so what? I mean, what are you trying to say? Look at the tooth alignment in 6 weeks. But mostly for these patients, if you look at the facial aesthetics, that's even huge. One of the things that Derek mentioned to you is creating volume and reducing treatment time. We're actually creating volume for our patient. This is the next stage in dental facial aesthetics. Now I'll be running courses in this room, hopefully next year, Derek. We have a discussion about bridging the gap in a missing link in dental education. We'll talk about later at the end of the lecture. But when you look very carefully on the oblique views, this is one of the most important views. I mean, you have a frontal view, you have a sagittal view, but oblique view gives you a really good three dimension in a 2D format. You can see the change in the patient's profile, reducing folding, improvement in the facial vertical height, reduction